the advent of next generation sequencing has been fantastic. It used to take months, if not years, to sequence an entire human genome. Now that can be accomplished in just a fortnight or less. And next generation sequencing allows us to examine the leukemia cells of our patients for specific mutations in genes that are very relevant. I think it's highly important that physicians in the community began to use this service, which there are a number of commercial providers that can do this analysis. What they actually do is they provide you with the mutational landscape for key genes that might influence the progression of the disease, such as mutations in TP53 that I talked about. This is highly important because those patients are at higher risk for developing resistance in the first place. But if you're using a drug, for example, that targets BTK, it's very important to also interrogate for whether the BTK gene has a mutation. And it's not just a mutation, but what type of mutation. So those mutations can actually influence the next choice of therapy, and that's highly important. We know, for example, that certain mutations in BTK will influence a resistance to the entire category of drugs, or just to a selected subcategory of drugs. For example, a mutation that affects the position at 481 in BTK will take out the ability to respond to both ibrutinib and acalabrutinib, as well as zanubrutinib. And therefore, if you have that information, you wouldn't be substituting one of these drugs for one another if you develop a resistance to the first drug. Rather, you'd go for another category of drugs, such as pirtobrutinib. However, we know also some mutations may affect the ability to respond to even pirtobrutinib or the covalent inhibitors. So I think it's very important to get this information so that you can strategize and plan your next steps of therapy and get the right type of targeted therapy that could actually benefit your patients.